Common stereotypes have followed Black people into decisions pertaining to their healthcare. Black people are undertreated for chronic pain within the healthcare system. A survey was done by the Proceedings of the National Academy of Sciences of 222 white medical students and residents. About half endorsed false beliefs about biological differences between Blacks and whites. This meant they were perceived Blacks as feeling less pain than whites and more likely to suggest inappropriate medical treatments for Black patients. In today's show, we are talking about being Black and in pain. And of course, we'll be diving into our question of the week. Is your health in your top 5 priorities of your life? Are you ready for another chronic pain conversation? Let's go. Hello, and welcome to Chronic Pain Conversations. My name is Sharifa McLaren, and this is my lovely co-host, Khalila Bourgeois. This is a show where we have open and honest dialogue about chronic pain. We share on our experiences, acknowledge the wide variety of chronic pain diagnosis, and look at ways to manage chronic pain. So you already know we are going to jump right into pain or pleasure to get a status up on where both our bodies are at for this show. So Khalila, pain or pleasure?
Today's a bit of pain. Today's a lot of pain. Unfortunately, I got some nerve block injections done yesterday, which I thought would help, but certain other areas are just, they're just failing. So I'm trying to keep my mood up for today because I love doing this show. But on the pleasure side, I had the opportunity to be on Fox Soul last night. So
you did so amazing. I was like, look at my girl. There's 2 segments with her. They took a break and all of that jive. I was so proud of you.
Thank you, Mama. I'm really trying very hard to be a face and an advocate for pain in general, not just our chronic pain, but, that's why, as the overcomer, we're talking about just how to go through life and overcome every situation. But enough about me. What's up with you? Pain or pleasure today, my love?
So I'm like you, 100% all pain right now. There's a lot going on. I'm not in my usual corners. There's a lot going on. But like you said, I love doing this show. And even talking about your interview yesterday, I sat there and I said, listen, if Khalila tells you that something's going to happen, believe her. Because the conversations that we've had and dreams that you've wanted to accomplish, they just coming at me left, right, and center. And I'm just
That's God. That's God.
but honestly, you believed in yourself, and with his help, everything's fulfilling. So I'm all pleasure with that because I'm proud to be doing the show with you. I'm really proud to be doing
I'm happy to do this with you too. Yeah. Okay. How about we get into a couple of things and start this show off right? Okay, so I have a question for you. I know it's our question of the week, but I want to think about what's going on with you. Is your health in your top 5 priorities of your life?
Okay, so I'm going to tell you my top 5 because when I think about it, I say God, my marriage, my family, my health, and then everything else. But then something goes off in my mind that my health is like at the bottom when for me personally, I think it should be at the top because let's just say God forbid something happens and my health is not intact. Life is going to go on without me. It's funny you asked that. What about you?
I would have to say that health for a long time has probably been in my top 5. It got reordered at different times of my life, but it is definitely God. Health is next because I'm nothing to my family and friends. Yep. I'm nothing to myself. I'm nothing to just my life if I don't take care of my health. And I think a lot of us put it down on the back burner. And in fact, people don't know this, but the original question was, what were your top three?
Mm-hmm.
And when you turned around and you were like, Khalil, it's not in my top three. I said, okay, let's move it to your top five. All right. But I want our audience to really think about, is this in your top five?
Mm-hmm.
What are your priorities? And people will say, my children are priorities, my work is priority, my career is priority. And when I had my accident in 2017, everything flatlined. It was taken away just like that. And the only thing I was left with was God and my health. And so, you don't realize how much your health matters when you're trying to lift a can, to walk to the end of the street, to get
a bottle of water.
Right? How many times have you had to ask someone to open something for you or do something for you? It's just, I get it, Mama. I completely get it. 100%. I did. Okay, so here's my next question for you. Mm-hmm. As a Black person, how do you advocate for your medical aspect when it comes to your health? Like, how do you advocate as a Black person for yourself?
I'm going to give you an example.
Okay.
I'm a person, I don't live by Google, but I like to do research.
Okay.
And so when I first got diagnosed with lupus and found out it was something that I was going to deal with the rest of my life, best believe me, I was on Google, I was on everything trying to figure out where this came from. Is it like, I came across that it's more predominant in Black and Filipino women. So Black and Filipino women get it more than maybe your Black or Filipino male. But those are the two ethnic races that get it more predominantly. And going to appointments and everything, I wasn't hesitant to bring that to my doctor that was overseeing me at the time and say, hey, since it's more predominant in Black people, could it have been a family lineage?
Oh.
And that's when my family got involved and got tested for any antibodies or stuff that may carry lupus. So I feel personally, I maybe don't do it as much as I should, but I don't hesitate to advocate, knowing what I know and using research and bringing it and say, hey, I found this. Can this be pertaining to maybe my race? Is there something that we missed? Can we do something to figure out more? So I feel I do somewhat a lot, but not as much as I maybe should.
So here's my question. When you went Google, we always like to do that. We like to do that self-diagnosis, check this up. Now, there's a difference between researching and self-diagnosing. Let's make that clear.
Right.
But when you found lupus, did you go to any of the lupus associations and on their sites? Did you, see what other people were dealing with? How did that set you off?
So I actually joined the Lupus Ontario.
Okay.
And I had connected with, I think she was like the CEO or some sort of founder of the association. And in having a conversation with her, she had told me that a lot of the people that she comes across within the associations that join are Black and Filipino. You have your little, other ethnicities there, but that was a predominant population.
Does it have anything to do with genetics or anything else like that?
Well, that's the funny thing. That's what we're told, okay? But I can tell you, people have gotten tested on my side of family and not a crumb has been found with my family. So I'm just the lucky one.
Okay. All right.
Yeah.
I think that for me, it's never mattered about my skin color. Okay. It's just, I've always just been somebody that advocates for myself. If something's wrong, I advocate for it, even for other people. So I think for me, it never came down to my skin. It always just came down to, I need to survive. I need to live. I need to have the breath of life in me, and I want to enjoy my life. So how do we make that happen?
Makes total sense. So, Kalila, our opening statement talks about false beliefs of the biological differences between Black and white people. What do you think about that?
Okay, so I was having this conversation. I don't know if it was with you or somebody else, but I think it's a double-edged sword. I think that it's a compliment, but I think it's a tear down too. I think it's a compliment because it's talking about we are survivors, we are overcomers, we push through it. But at the same token, I think that it's not just them looking at us. I think that it's us and how we advocate and respond and deal with our health as well. So if we're not complaining or really looking into it that much, they don't know, right? And so and if we're not taking the Stats Canada, they don't know. So there needs to be a point where, you might be, and that's a big thing, like culture affects us. Our upbringing affects us. We'll get into it a little bit later on, but then there's that conversation about you must be seen and not heard. As a West Indian culture, you hear all of those things, and those things affect your mind. And from your mind, it affects how you go through the rest of your life. And a lot of people are like, see me, but it's like, well, yell. It kind of reminds me of, remember Dr. Seuss, and there's that book, and there's Edbert the elephant, and on that one little rose, there's all those people that live on that daffodil,
right?
And they don't believe in him, and they all have to come together and yell and scream to be heard because they're so minute. You got to yell and scream to be seen, and not necessarily yell at the top of your lungs,
right.
But it's a double-edged sword. And that also can come from, like, I hate to say it, we're talking about Black History Month. You've got this slavery mentality. Well, they've pushed through it. They've been sore. We've beaten them up. They still keep gutting down. We've had the next generation again, where we're just work hard, hush up your mouth, take it all in. And I think that in that opening statement, I believe it's 100% true. But I do not want to say that it's just on the perspective of the physicians. I do think that we as Black people, as people of color, need to take ownership. And the other thing about it might be this. We may not be going to the Western physicians. We may be going through our own home remedies, our naturopaths, and our own other doctors. And that's the other thing that we have to keep into consideration, right? How much do we trust the Western medicine?
100%. And
what are your thoughts?
My thoughts about it, it was amazing to see. So the fact that they said half believed the false beliefs. Can you imagine how many of those people actually took it and walked away with it? And that's what they're thinking. And it bounces back to what you said. It's not only about the physicians, but we have to try to change that too. So we have to speak up for ourselves. Don't take things lying down. My mom will always say, you can't take things lying down because then nothing changes. And then how do you expect for things to change?
Now, here's a really interesting perspective. With Black History Month, everybody talks about racism and different things like that. But those physicians didn't come out with that thought. They weren't born with that thought.
No.
Somehow between birth and them taking that survey, life journeys happen to give them that perspective. So the question really is what was their journey to make them come to that perspective?
Right.
And where did they do it? Did they do it with clinicians that are working in a predominantly Black area or semi-Black area? All of those things do matter, but it is sad. It is really sad to know that when I walk in, it's very upsetting to know that when I walk in, that because as soon as you see my color, there's a bias against me.
Not
necessarily intentional, but there's a bias because God decided to make me, a little caramel. You know what I'm saying? And
then you got the dark chocolate.
Hey!
Okay, so this week being the last week of Black History Month, we thought we'd have a little conversation. So, Kalila, we speak about Black Lives Matter, those who've paved the way, national Black heroes. But Kalila, you and I are going to bring another perspective to the table.
Let's go, girl. Let's go.
So, according to a CBC article, the common theme is that there's little representation of Black Canadians in health settings. And it's important for patients to see themselves reflected in the health system. So, Kalila, how important is it for you to see yourself represented in the health system?
You know, I'm probably going to get shot for this.
That's okay.
We're
having awkward
because everybody wants to see the Black president. Everybody wants to see the Black doctor. Yep. Everybody wants to see the Black golfer, the Black basketball. We had this conversation. Excuse my language. I don't care what the color of your skin is. I care that you know how to take care of me. You know how to educate me. You know how to deal with my body. Is it important to see it so that you know you can strive to become it? Yes. There is always an importance. That's what mentorship is. That is what, you know, being a trailblazer is. It's being able to set ground so that other people understand that they too can reach that peak, that plateau, that there's nothing that stops them. Is it important for people is it important for our youth and our young adults and people to be like, hey, I can be a physician. Like I was telling you, there's a story about a mother and a daughter who both graduated. They're Black. They graduated from medical school the same year, right? Great. But even if you're still Black and you don't know how to take care of my health, that doesn't mean anything to me.
Yep.
Right? But I do think that it's important that we see people, we do see our color and our race excelling to be the best version that they could possibly be in any industry that they want to be in.
Right. I totally agree. Yes, it's very important that, you know, we should be represented in the health system, but I don't hesitate to ask my doctor whether he's Asian, Caucasian, Indian. I don't hesitate to ask him the same questions that I would probably ask a Black person. Because at the end of the day, I want you to help me do what I need to do, find the resources or things that can help my body be at its best health. So yes, it's important we're represented, but at the end of the day, it boils down to you and how you handle your health.
It is. It really does. It really does. Well, let's talk about some coping and support, because one of the things that we don't talk about in terms of the Black culture is that can culture and traditions play a role in how someone accepts or acknowledges chronic pain in either their life or in their family's life? Because the first thing that I always think about is like when we're in pain, your grandmother, your mother, it's gas.
Or along with that, just make some ginger tea and drink it. The gas will pass. Pardon me?
Right. And there's this difficulty where, you know, you could be like, no, I'm in real pain. Suck it up. And I know that, you know, even though we're talking about Black and in pain, a lot of other cultures and ethnicities have that it's the mindset, right? So, you know, we were talking about, I am first generation from the West Indies, right? A lot of people are first generation. Our parents were the West Indians, but we're here in America, right? So we have a different kind of cultural upbringing. But do you feel like, you know, sometimes that culture, those traditions stop your family, your friends, your church people from from accepting some of the things that are happening?
Okay. 100% at the beginning. And I think it was because I wasn't very vocal.
Oh, okay.
And I didn't really explain how I was truly feeling for them to get a sense of this is not gas. And I actually have not heard that for, I want to say, the past 5 to 6 years.
Right.
Like when I say I'm in pain, I'm asked where. What does the pain feel like?
Right.
And there I explain, and we'll use the cold freezer.
Right.
I feel like I've been in a cold freezer for, 10 days straight.
Right.
No break, no coming out. And then they're like, oh, whoa, that's not normal. Maybe you should ask your doctor about it.
Right.
So with that, I'm thankful. Because I think me communicating has changed that. Oh, it's just gas. Oh, go drink some tea. I think me communicating that has changed. So
Okay.
with that, I'm thankful. But 100%, I know you and I are not the only people who maybe even still throughout all their pain hear it's gas. Go drink some ginger tea. Go boil this. Go boil that. Like, I'm pretty sure there are still people who could have years of pain and are still hearing that.
And they are, and they are. And so I think that what I'd love for our audience to really take a look at is, and it's not that they're trying to be
No.
difficult. Sometimes it's actually just a lack of knowledge or naive or
Yep.
culture or tradition. And so we have to take a look at if those things are in fact affecting our community or how we think about our own pain.
Yep.
Now we did a search, and we were talking about the 3 chronic pain diagnoses that are most common in our colored community.
Right.
And we came up with the lower back, knee pain, which is arthritis, and then general pain in the joints. Do you have any thoughts or comments as to why those might be the 3 top issues for our culture?
I really don't know. And I want to tell you, I do have all of those when it comes to chronic pain. But then I'm not sure why. Like, is it a lineage thing? Like, is there something within the Black person's body that, I don't know. Do you have any idea?
It's the Black person's mindset. So we are hard workers. A lot of our Black community are blue collared tradespeople. Not to say that we don't go into the office,
right?
But we are hard workers on the front line.
Okay.
And so we'll come home and we'll have our back pains and we'll have our issues and we won't tend to them. And when we don't tend to them, that makes it even worse. When we were talking about the knee pain, the biggest thing, like when we had our guest on Kamal, Calvin, he was on in January. And he was talking about jumper's knee and he was talking about being athletic. And I was thinking to myself, how many of our colored boys are like, they're in track and field, they're in basketball, so now before you even get into the workplace, you're such an athlete that you may have been destroying some of your tendons, some of your joints, running away at the bones, and people don't even know that. And then you're living the rest of your life ignoring it, not getting help for it, not understanding it. And those were my thoughts about that. It's funny enough. It's that we're strong. It's just that we're active. We're hard workers. And then at the end of it, it's actually tearing us down and we're not taking care of our health.
We're doing damage in the meanwhile, then the rest of our lives, we're suffering with chronic pain. That makes a lot of sense.
That's just my thoughts though, folks. Okay.
No, for sure.
Those are just, we're not experts. But if it makes sense,
yeah,
and you've been having some ailments, go get it checked out.
So, Kalila, do you ever have that pain in your foot that maybe you're like, like I know for me, when my arthritis first started, I'm like, my grandma used to have arthritis. Like, this is probably just like, a family thing or whatever the case is. But my real question is, how many of us do you think are more to just ignore it and just say, okay, maybe I got this from grandma, maybe I got this from Aunt Pat, or are we more head on to go get it professionally checked by a doctor?
Do you want the truth? We won't talk the truth.
The truth. I don't want no fake news.
To my experience, to my experience and what I've seen growing up, I believe that the colored community doesn't go until blood is actually bleeding, until a bone is actually broken, until, like I had, my father was in pain last year and he refused to have the ambulance come and get him. He was like lying in bed for days. Right. But we hear it all the time. I've seen people's moms. There was somebody's mom who ended up having like a button, like a pimple that turned into like a cyst. And then by the time she decided to get it done, she had to stay home for a month. But it grew that whole time. And we're like, go see it. Like I tell my mom, like, Mom, your skin color above your knee and below your knee are 2 different colors. Can you please go and get that checked out? She's got something on the back of her back. And I said, I went and I took a look at it and I'm like, Mom, that's not a pimple. So now I'm concerned because your leg has 2 different colors and you got something on your back. Mom, go get yourself an appointment. I don't think my mom's gotten her appointment. I think that it's I think that we don't educate ourselves, and I think that we don't take our health as seriously, or we try to push through it. We have been taught to have this push through mentality, and I think that that can actually hinder us and not help us in terms of our health or recognizing the issue in it's like the nail in the hammer. Like, you got to hammer it a couple of times for it to go down.
Right.
We allow life to hammer that nail into our body.
Yep.
And it's not until that nail is like broken us. It's not until that's final straw that we're like, oh, but I'm like, but you spent the last 5 months you didn't see that.
And let's just be truthful. We do get symptoms. We just don't pay attention to it because of the mindset that we were grown up with, or the teachings that, mom and dad taught us. It's okay. Don't worry about it. We do get our symptoms, but we can't go check it out.
Here's the thing. Here's one thing that I have noticed, and it's not in terms of just being Black or racial. It's that we don't listen to our symptoms. But now, as chronic pain sufferers, our symptoms yell so loud that we don't have the opportunity to ignore it. But our symptoms have always been telling us stuff. We just push it, compartmentalize it, don't deal with it.
Yep. 100%.
So, here's one question for you, because before we get into our wrapping up, is treatment, medication, and therapy. So we were talking about the Western medicine, and we were talking about the Western medicine. Do you feel that, like, the home remedies, we're just for let people know, I've got a Trini background and Sharifa has a Jamaican background. Do you think that some of our home remedies are as effective as the Western culture?
Okay.
Go on.
So I am going to be honest from what I think. It's 50-50.
Okay, talk.
I say 50-50 because growing up, there have been things, concoctions, I call them, that have, been given to me for certain things, and they've worked. I'm not going to say they don't. But I feel to an extent they do not always work, and we do need to go get that professional help. We need those prescriptions sometimes, because like Lulu said, our chronic pain cries so loud that the home remedies are not going to do anything. Let's just be real.
It's really funny because, we're here in America, and if you were to go to Asia, if you were go to the West Indies, the medicine, the pills aren't the first option.
Nope.
And so it's only the first option here in America. And so I truly do believe, because before there were pills, right? Pills have not been around before Christ.
Right.
They've been using the home remedies. And in fact, the pills are what comes from those home remedies. Do you know what I mean?
Yeah.
And they put a lot more fake stuff in the pills than you get with the home remedies. And I think, not to go onto the Christian side, but I do think that God purposely knew what he was doing when he created different things. And more like merengue or, the ginger or,
or charcoal. Have you heard charcoal?
Say that again. Charcoal. That's another one, the paprika, the cayenne pepper. I do think that and I won't say that they're home remedies. Maybe that's not the right word, because we should be respecting the fact that there's natural remedies. Maybe that's the word that can truly help us, because part of my medicine cabinet, half are supplements. I try to get myself off of as much meds because they leave more damage than the natural remedies.
Right.
Right. Yeah. That's my thought.
Okay. So, I did some research. So I wanted to go into maybe harmful or even helpful ethnic foods that can, either do harm for our Black people in chronic pain or even just help with our chronic pain. So
what'd you find
in researching, I found that inflammation plays a huge role in chronic pain.
It does.
So When we get into helpful foods, we're talking like our fruits. You know, we all love our mangoes, our guava, papaya. All those fruits can do so much helpful things. They carry what do you call it? They carry things that fight inflammation.
They're anti-inflammatories.
Right, there we go. So that all those fruits, 100%, if you can get your hands on those, don't hesitate. Mm-hmm. They help you 100%. Leafy greens. So, you know, your salad.
The darker the green, the better.
Yes, yes. We Jamaicans have something called callaloo. What did you say you call it in Trinidad?
Okay, so they call it callaloo, but you know, some people use okra, some people use dashing leaf, right? Some people combined it.
Right.
Sometimes it could, my mom would say it could be spinach. So it varies on what is being said and used.
Right, right. But that also is anti-inflammatory and it helps greatly. Now, Kalila.
Yeah.
I'm going to use my husband as an example. He loves his fried dumpling. So
stay away from it.
Dumpling. Other islands will say fried bakes. Okay?
Okay. I'm going to stop you right there before you finish.
Go ahead.
Okay. Go ahead. First and foremost, now that I've been working with the nutritionist, I've noticed a couple of things. Mm-hmm. So when I have my fruits, which also, I want to also say this, one of the things that we don't talk about is, you know, as people of color, we have different genetics. And so some of the fruits and the foods work for our body or against our body, same way with, you know, poultry or beef. Mm-hmm. But, you know, I can attest right now, when I'm eating on my fruits and my salads and I'm eating very healthy, my body trims down. As soon as I put gluten, flour, noodles, rice, anything like that, it can take 3 days for it to go through my body. 3 days. What other food is piled on top of that, right? I can immediately see my foot go from this to this, right? Like I said, our bodies tell us what's going on. We don't pay attention to it. People, the gluten was not good for our body. It's not good.
We love it, but let's just be real. It does not help. It doesn't help. The oily, the deep fried fritas and all that stuff, it doesn't help.
And it comes back to the cultural thing.
Yeah.
It comes back to the cultural thing. Yep. It also comes back to, you know, whether you're making it or buying it. Those are two different things. My mom might make bread for me and it doesn't hurt as much. Whereas if I have, you know, the bought bread, that's affecting my body in a completely different way because there's more things added to it.
Yep.
Right?
Yep. 100%.
You were talking about fried oil. Oil is a huge thing that we don't have a conversation about, right? We want to use the vegetable oil or the canola oil. We don't want to use the coconut oil. We don't want to use
the olive oil.
We don't. And it's not until we have a heart attack. It's not until we have something that is like, oh, change it. We're trying to be proactive.
Yep.
Don't wait until your heart has clogged up with your arteries. Start making changes on what you eat. Educate yourself. Knowledge is power. Yes. You can still have some of the foods that you want, like the fried bacon, the fried dumplings, but there's ways of tweaking it or ways of having it more healthy for you.
I have a suggestion.
Let's go.
Usually, to substitute like white flour, I use whole wheat.
Okay.
Instead of using, let's just talk about oil. I tend to use olive oil.
Oh.
I tend to use olive oil. Like if I'm steaming vegetables, I'll sprinkle a little bit of olive oil over it. But again, not that much.
Okay.
There's a lot of things, like Kalila said, that you can substitute, you can tweak it a little bit to make it more healthy.
Okay. So let's get into the question of the week because we're talking about our health right now, right? And so our question of the week is this. Is your health in the top 5 priorities of your life? Right? So we answered it and we got a couple of responses. One of the responses we got was from this lovely lady, Angela Brown. Hey, lovely. She said, God, family, health, friends, career. That's actually for me, not a bad order. My health is very important because of my chronic illness. Now, that's what's really interesting for me. Her comment was, it's again, just like me, the chronic illness is what changed certain things.
Yeah.
And she also says, I have to be careful about what I do, where I go, along with who I see, especially in this time.
Mm-hmm.
And it's not even just about your health, but when we talk about health, we're not just talking about the medicines. We're talking about the treatments. We're talking about the stress. We're talking about the mentality. That's a whole other conversation about being Black and depressed, which is what everybody else has been talking about for Black History Month. So I'm pretty sure if you go out there, you can find it.
Right.
But our health is not just, it's mind, body, and soul.
Mm-hmm.
It's mind, body, and soul.
Yeah.
Tell me, my love, what is our keep it moving moment for this week?
Okay. So you're going to love this one.
Am I?
This is from, it's from Marcus Garvey.
Marcus Garvey.
And it says, a people without knowledge of their past, history, origin, and culture is like a tree without roots.
Right.
I'm going to say it again. A people without knowledge of their past, history, origin, and culture is like a tree without roots. Good at you, Marcus.
Behave yourself. I love it, but it's so true.
It's true.
You brought up a really good point earlier on at the beginning of this episode, was talking about whether it's genealogical, you know, and there are some things that could be or may not be. So, for example, when we talk about diabetes isn't genealogical. It's not passed down. It's actually because of the culture in your household that passes it from one person to another. So really and truthfully, like you said, look into your past, look at how you've been growing up, look at what your environments might be, look at a lot of different things, but know where you've come from so that you can create a foundation on where you're going. And
think about how you can change. Think about how you can change things too.
Yeah, definitely. Okay. So my final thought for today is definitely this. It comes down to your mindset, your education, and respect for yourself and your clinical team. When it comes to Black pain, I think that those are the things that are important, right? What is your culture upbringing? What is your mindset about health? What is your education about you actually taking care of yourself? How much do you respect you and your health? And also, how much do you respect your clinicians? Because here's the other thing. I hear so many complaints about people that are like, my doctor doesn't listen to me. My doctor, and I'm not shutting anybody down for it. But I am going to say this. If your clinicians, their clinicians have gone to school, paid good money to get themselves educated. They don't know everything unless you go in and work with them. It's a team, right? And respect them. Respect what they are doing. Understand that they may not know everything. They are not your one-shot answer, but respect the fact that you can actually go in front of them and pick who you want to pick. The other thing that I wanted to say with you was this. You know, we're talking about Black and in pain. And this week, we didn't bring up any special associations. And the reason why I did that was, or the reason why we did that was because this isn't about supporting a Black physician or a Black association. That's what not today's show was about. Today's show was being about you being a person of racial color, and you respecting your health, you taking care of your health. So really and truthfully, it's not about if your physician is Oriental, Caucasian, Black, Filipino, whatever. It's about, is the clinician helping you sustain your life and have a comfortable and enjoyable, healthy life? So that's my final thought.
Well, my final thought is really simple. There's a lot that we see in here that goes on in our health system. And let's just face it, it's not at all great at times,
Mhm.
but we as a Black race need to take what we know, and trust me, there's a lot that we know, but we're just not really, pushing ourselves. And we need to take what we know to keep pushing forward to make things better for ourselves and maybe even the people after us as well.
Mhm. Mhm. I love that. Thank you so much. All right, guys. Well, that's our show. My name's Kalila Bruswell. I am the Overcomer.
And I'm Sharifa McLaren Thomas from YouTube's The Thomas Life.
Thank you for joining us for another episode of Chronic Pain Conversations. We'll be back next Tuesday at 12 p.m. We're not telling you what our topic is because it's going to be a surprise, but you can follow us on Facebook, YouTube, and Instagram at CP Conversations. And if you are a chronic pain sufferer who would like to share your story, we invite you to be a guest and visit our bio link on any of our social media platforms. We want you to have a very, very blessed day. And remember, Chronic Pain Conversations is the show that enlightens and advocates about chronic pain. Hope you have a very blessed day.